Okay, so now we're going to talk about splinting specifically for rectoceles. So I'm going to preface this with, this is no fun. And when I meet someone in person and I get to assess their rectocele, I give this talk very, very cautiously because it sucks. It just does. So I also let the people know I I have to do this, or I've had to do this. I have gotten my everything under control. I'm asymptomatic. I only have to do this if we're traveling and if I'm constipated and if all the things aren't working out for me. Because splinting is actually touching that space to help you poop more efficiently. You will not get poop on your hands, but you will get pee. So I like this picture, yet whenever I show someone this picture, I show them that the rectum is actually really, really close right here, and that they may, there's two different ways to apply pressure at the perineum or give some support at the pelvic wall. So that way the rectum will empty into the anus more efficiently instead of pushing into the vaginal canal. So remember, no poop is coming into the vagina, but it is having trouble exiting efficiently. So you will not get poop on your hands, but everyone will get pee on their hands. So you'll want to move scrunchy of whatever hand you're doing, and as you're reaching up into this space. So the double pooping or inefficiently pooping is whenever the poop comes and then it moves too far forward to the vaginal canal, and then a little bit gets stuck in there as you go, and then you stand up, move around, and then everything wants to come out. So if you lean forward, have a gloved hand, clean hand. I personally don't use gloves. I just make sure my hand is clean because your thumb is going to go into your vagina. So you don't want to cause increased bacteria, increase UTIs. That's gross, guys. Okay. So one thumb into the vagina, leaning forward, doing all your techniques of pooping, and the poop comes. And then instead of falling forward into the vaginal canal, it is now just leaving your body, which is really neat. I usually will try to do this as effectively and efficiently as possible. And then at the very end, I may put a thumb into the vagina and then see if anything, and then bear down and then see if anything comes out. And most often than not, something comes out when I was having this issue, which was faster than I thought it was. I thought that this was going to be the end of the world. This is miserable. I don't want to do this the rest of my life. And I didn't. So I do want to show you that if some people cannot reach this space, there is a option for a handle. So I'm going to share that with you. CMT only does pelvic floor things, devices. And so this is what it looks like. So in this, there's two different ways to use the handle. So you can use this part at your hand. This part is like at the front of you, and then this part is inserted vaginally, and then is press is the backstop. You can also use it in this way. So handle, handle, this is here, so that way your tummy can lean forward, and then you're just applying pressure at the perineum on the, not internally. So I find that this is not as efficient, but it is really good for someone that has rectal prolapse, so the rectum is actually leaving their body. I cannot simulate rectal prolapse in the clinic. I usually have someone, which sounds super weird. I know we do weird, but I have someone take a picture of their bottom after they pooped, and then I can tell them like, oh, well, that looks like an external hemorrhoid. That looks like an internal hemorrhoid, and that actually looks like your whole rectum is prolapsing out of you. But then you would still treat it just the same way. And so this is a picture of what it looks like if you're using, think about if you're using your thumb, applying pressure there, and then just not letting anything sneak forward. This is $49.99. I never did buy this, honestly, because I hate cleaning things. It looked like something else, and I was gonna have to keep clean. I think I was gonna have to, you would want to wash it off with soap and water, Um, I'm already gonna have to wash my hands though after I pee. Like, I don't know, I just felt more comfortable with using this. I hate spending money, but if you can't reach this space, $50 is pretty great. Um, and it's very hypogenic. It looks just like a shoehorn, but you wouldn't want to put a shoehorn there. Like, be that should not even ever happen. But I find that people will try anything to stop these symptoms. So I'm going to go back to my handout. So it goes over the different types, 1 and 2, different types of splinting here. But just remember that you're just changing the pressure and changing where all this space is going. And so that's something that I'm going to be looking at internally and with your exercise and making you more efficient at breathing and all the things. And you want to be more efficient at pooping, and you remember all of that from a previous handout. So remember, this is no fun. It is efficient, and it can get the job done. And I usually go over this with someone in person so that way they can see that I'm very empathetic about this. Speak with your surgeon or doctor about this. Some people, that's what leads them to want to get the surgery, is they just don't want to do this the rest of their life, and they'll be with me for several months. Most people are, it depends on the severity whenever someone meets me. There's no most or normal. Um, but I want you to remember you're fearfully and wonderfully made. Take care and God bless.